Nipah virus is a deadly disease. It has garnered significant attention from the global health community due to its high mortality rate and the potential for widespread outbreaks. The virus is known for causing severe respiratory and neurological symptoms, which can lead to fatal outcomes if not managed promptly and effectively. It can infect both animals and humans. This dual-host nature makes it particularly challenging to control, as it requires coordinated efforts across veterinary and human healthcare sectors. The virus can spread through direct contact with infected animals or their bodily fluids, making those who work closely with animals, such as farmers and veterinarians, particularly vulnerable. Scientists first discovered the virus in 1999 during an outbreak in Malaysia. This initial outbreak was a wake-up call for the scientific community, highlighting the need for better surveillance and rapid response mechanisms to emerging infectious diseases. The outbreak led to extensive research and collaboration among scientists worldwide to understand the virus and develop strategies to combat it. The virus gets its name from Sungai Nipah, a village in Malaysia. This small village became the epicenter of the outbreak, and its name has since been associated with the virus. The local community was heavily impacted, with many residents falling ill and the local economy suffering due to the necessary quarantine measures. This is where researchers first identified it. The identification of the virus in Sungai Nipah was a crucial step in understanding its transmission dynamics and developing appropriate control measures. Researchers worked tirelessly in the field, collecting samples and studying the virus's behavior in both animal and human hosts. The outbreak primarily affected pig farmers and those in close contact with pigs. These individuals were at the highest risk due to their frequent and close interactions with the animals. The virus spread rapidly among pig populations, leading to significant economic losses for farmers and necessitating the culling of infected animals to prevent further transmission. Nipah virus is a zoonotic disease. This classification means that the virus can jump from animals to humans, a characteristic that complicates efforts to control its spread. Zoonotic diseases often require a multidisciplinary approach to manage, involving experts in animal health, human medicine, and environmental science. This means it can spread from animals to people. The transmission can occur through direct contact with infected animals or through consumption of contaminated food products. For instance, consuming fruits or fruit products contaminated with bat saliva or urine can lead to human infection. Fruit bats, also known as flying foxes, are the natural reservoir of the virus. These bats play a crucial role in the virus's life cycle, harboring it without showing symptoms, and thus facilitating its spread to other animals and humans. Understanding the behavior and ecology of fruit bats is essential for developing effective control strategies. These bats usually don't show signs of illness. This asymptomatic nature makes it difficult to identify and control the virus in bat populations. Bats can travel long distances, spreading the virus to new areas and increasing the risk of outbreaks in previously unaffected regions. However, they can shed the virus in their saliva, urine, and feces. This shedding can contaminate the environment, leading to indirect transmission to other animals and humans. Researchers are working to develop better surveillance systems to monitor bat populations and detect the presence of the virus early, which is crucial for preventing future outbreaks. The spread of Nipah virus. Nipah virus infection can cause a range of symptoms. Some people experience mild flu-like symptoms. These include fever, headache, muscle aches, and fatigue. Others develop more serious symptoms. These include coughing, difficulty breathing, and confusion. In severe cases, the virus can cause encephalitis. Encephalitis is inflammation of the brain. It can lead to seizures, coma, and even death. Currently, there is no vaccine or specific treatment for Nipah virus infection. Therefore, prevention is crucial. Avoiding contact with bats and pigs in endemic areas is essential. This includes not visiting bat roosting sites or pig barns. It's also crucial to avoid consuming raw date palm sap. Make sure any food products are from reliable sources and handled hygienically. Nipah virus encephalitis. A closer look. Encephalitis is a serious complication of Nipah virus infection. It occurs when the virus infects the brain, causing inflammation. Symptoms of encephalitis can be severe. They include high fever, stiff neck, drowsiness, disorientation, and seizures. In some cases, encephalitis can lead to permanent brain damage or death. Section 6. The importance of early detection and treatment. Early detection and treatment are critical for improving outcomes in Nipah virus infection. Identifying the virus at an early stage can significantly enhance the chances of recovery and reduce the risk of severe complications. If you experience any symptoms after potential exposure, seek medical attention immediately. Symptoms can range from mild to severe and may include fever, headache, dizziness, and respiratory issues. Early medical intervention can help in managing these symptoms effectively. While there is no specific treatment, supportive care can help manage symptoms and complications. Supportive care involves a range of medical practices aimed at alleviating symptoms and improving the patient's comfort and overall health. This may include hospitalization, intravenous fluids, and medication to reduce fever and inflammation. Hospitalization ensures that patients receive round-the-clock care and monitoring, which is crucial for managing severe cases. Intravenous fluids help maintain hydration and electrolyte balance, which is vital for the body's functioning. Medications to reduce fever and inflammation can provide relief and prevent further complications. In some cases, antiviral drugs may be administered to help combat the virus, although their effectiveness can vary. Isolation of infected patients is also a critical step to prevent the spread of the virus to others. This involves keeping the patient in a separate room with strict infection control measures in place. Family members and healthcare workers should also take precautions to avoid exposure. This includes wearing protective gear and following hygiene protocols. Education and awareness about the virus and its transmission are essential for both the public and healthcare providers. Community health initiatives and workshops can play a significant role in spreading awareness and educating people about the importance of early detection and treatment. These programs can provide valuable information on recognizing symptoms and seeking timely medical help. Ongoing research and development are crucial for finding more effective treatments and ultimately a vaccine for the Nipah virus. Scientists and medical professionals are working tirelessly to understand the virus better and develop strategies to combat it. In conclusion, early detection and treatment are vital in managing Nipah virus infections. By seeking prompt medical attention and following recommended care protocols, patients can improve their chances of recovery and reduce the risk of severe outcomes. Section 7. Global efforts to combat Nipah virus. The World Health Organization, or WHO, recognizes Nipah virus as a significant public health threat. The organization is working with countries to strengthen their surveillance and response capabilities. Research is ongoing to develop vaccines and treatments for Nipah virus infection. Scientists are studying the virus, its transmission, and potential therapeutic targets. Section 8. The future of Nipah virus research. Scientists are making progress in understanding and combating Nipah virus. Research focuses on developing effective vaccines and antiviral drugs. One promising area of research involves monoclonal antibodies. These laboratory-made antibodies can target and neutralize the virus. Section 9. A call for vigilance and preparedness. Nipah virus infection is a serious threat, but we can take steps to protect ourselves and our communities. Awareness, prevention, and early detection are key. By understanding the risks, practicing preventive measures, and seeking timely medical care, we can minimize the impact of this deadly disease.